Hey everybody, it's Jenna, and it has been exactly 1 week since surgery, and I feel good. I weighed in this morning, and I weighed 296, which is exactly a 10-pound loss for the week. When I weigh at the doctor's office and the hospital, like the day of surgery, it said that I weighed 311, which is probably accurate. But my scales here at the house said that I weighed 306. So I'm just doing I'm starting with 306, because I'm not going to go buy new scales or anything. So I'm starting with 306. So, if I went to the doctor's office, every time I go to the doctor's office, I'm going to weigh about 5 pounds more. So that's where we are. And so I really lost 10 pounds. My mom said she could tell. Of course, I can't tell, and she was probably just saying that to be nice. I don't really care. I feel like a lot of that is just a lot of water weight, and I feel like I kind of been dehydrated for a few days here, but I'm getting better. Okay, so let's talk about a few things, and let's talk about, I said that I was scared of the pain. I'll talk about the pain, and then I also wondered if I was going to kind of freak out after surgery and wonder if I made this huge mistake and if I would have any regrets. Okay, so when it comes to pain, that was the thing that I was really scared of. I just did not know what to expect. And like I told you guys, the most painful part for me was directly right after the surgery when they woke me up and I had no pain medicine at all. But it wasn't an excruciating pain or anything. It was just I could just feel a lot of the gases, because they blow your stomach up with the CO2 gas to do the surgery, and I could just feel a lot of the gases moving and shifting, and it was it really did hurt. I mean, I was almost in tears, but it wasn't as bad as I kind of prepared myself, I guess you could say. So the pain has not been bad. I guess the most painful part for the first few days is just getting up and getting out of bed. Even when you go, when you're trying to use the bathroom, I didn't even think that was as painful as trying to get up out of bed. Even though the bed is, those hospital beds, you can sit them up. So even though I had the bed sitting up, just trying to get the last foot lifted by yourself so that you could get out of bed, and you have to use all your ab muscles, that kind of hurt. It just kind of felt like you had just had a really tough workout the day before, and it hurt. So, and then of course when I came home and I didn't have one of the hospital beds or anything like that, I slept on the couch and kind of had the pillows layered to prop me up, and then every time I needed to get up, I had to get my mom to grab my hands and help pull me up. But that only lasted a few days, and then one morning I woke up and I said, well, my pain pills, they're worn off, aren't they? It's been 12 hours since I had pain medicine. And my mom said, yeah. Do you not hurt? And I said, no, I don't hurt. And so I just I sat up. It was, it was a little tender. I mean, I'm still a little tender. It just kind of feels like somebody punched me in the stomach, and it's just a little tender. But I mean, as far as getting up, getting down, I mean, I do it without thinking now. It doesn't hurt at all. So that's good. The pain has not been bad. I cannot complain. And I did not, I mean, I have a whole bottle of pain pills. They sent me home with pain pills, and I think I took 4 of them. I just, I haven't been in enough pain to even worry about the pills. So, anyways, then I worried about getting home and having a lot of regrets and being oh my God, what have I done? And I haven't, thankfully, I have not had that moment you know, the anesthesia, like, kind of makes some people go crazy for a little bit. I don't think I've gone crazy. I think I've been very much sane and, you know, had my head on straight and everything. I never had that moment where I don't regret anything yet. Like, I know that I did what I had to do, and I'm really glad that it's over. And I'm glad that I'm at the hospital, because hospitals just really creep me out, and they smell bad and everything. But no, I have not had that moment. Do I miss food? I miss food. I do kind of miss food, but I think that's because I'm just so new. Like, I mean, I'm only a week out, and everything that I'm doing right now is new to me. And by the way, I hate protein shakes. I started drinking, like, for the past 2 days, like, even the muscle milk, like, kind of makes me, like, start gagging towards the middle of it. I'm tired of the muscle milk. The hospital called me today to do, like, a 1-week follow-up. It's, like, actually part of the bariatric center, so it wasn't, like, the hospital. But they called to do a follow-up. Okay, I have no idea what I was just talking about. I had to answer I had to answer my phone because that was my boss. Okay, but anyways, I think I was talking about, like, have I had any regrets and do I miss food? Okay, yeah, I kind of miss food right now, but I know I did the best thing for me. I tell you, like, I have not been hungry. I can honestly say that. Like, I have not been hungry. Have I been thinking about food? Yeah, that's mental. That's mental, and that's something that, like, I have to get over. And that's really something that, like, I didn't really prepare for, you know, as far as, like, oh, God, it's been 3 hours since I had something in my mouth. Maybe I'm hungry. Maybe I should eat something. And then I'm like, no, I'm not really hungry. I don't really want anything. And, like, I'll start eating, like, some sugar-free pudding and take, like, you know, 4 bites from, like, one of my little miniature spoons and be like, okay, I don't want this anymore. So, I mean, that's, you know, whatever. I'm kind of ready for, like, normal food. I just want to be able to, like, you know, like, have a pretzel or just actually be able to chew something. Like, I'm tired of all this soup and everything. So I have 1 more week, and hopefully it goes by fast. I will be going back to work tomorrow, and I feel fine. I mean, I feel fine enough to do that. And I'm sorry. Yes, okay. My mom's sitting here sending me text messages asking me if I've taken my vitamins. Okay, but yes, I took my vitamins. Okay, but I will be going back to work tomorrow. I feel fine. I've been driving, you know, seatbelt, that doesn't bother me. I put, like, you have these little patches. They're about this big, and you have 5 of them, you know, because you have, like, 5 little small incisions. And they gave me a little note when I went home from the hospital that said the patches could come off, like, a week later. Well, one of the patches was like kind of, you know, the sticky was coming off, and I wanted to go ahead and take it off because when I'm taking a shower, like, I didn't want water to get down in there and, like, soak up into the pad and everything. So I took one of the patches off today, and I was expecting it to be, like, really gruesome and everything. Like, I don't know, I kind of prepared my mom. I was like, well, I'm taking a patch off, so, you know, if I need you, be available. So, but I peeled it off, and seriously, it looks like a little bitty, like, cat scratch. That's what it looks like. And so I just took one of the patches off. I'm going to leave the rest of them on until they start, like, raveling and stuff, until the sticky starts coming off, because it hurts to take them off. Just, like, pulling on your skin, it hurts. But as far as, like, the little incision, it is so tiny. Like, they said, well, it'll be like the size of a pencil eraser. And I was like, okay, right. But it really is. It's like the size of a pencil eraser.